Well, I had a background in Maine. My father trained in Bangor as a seminarian and a minister, and so I grew up in several rural communities in northern Maine, in Millbridge and in North Anson, and have been in Connecticut for the last 25 years, and thought this would make a good opportunity for me to bring my parents back as well as myself back to Maine, and we've been delighted to be here. And I've enjoyed the last 18 months of my journey back to Maine in taking care of outpatient cardiology and outreach cardiology in rural Maine, and had an opportunity to come down and join the group here at Central Maine and be involved with the healthcare in this area, and have been very excited to be here.
Awesome. So tell me a little bit, you said you're excited to be back here, but what would you like to tell, your potential patients about, and like what are you bringing to, here to Central Maine with you, and why else you're so excited to be here?
Sure. My area of cardiology is non-invasive cardiology, and that consists of looking at individuals with valve problems, heart disease, irregular heartbeats. Special area of interest is women's heart health, which I'm bringing to this area. And also I have a background in holistic medicine, and so I try to balance a little bit of the conventional treatment of illnesses we're all familiar with all of the options available, some of which are traditional and appropriate, and some of which are sometimes non-traditional. And so hopefully I can bring a little bit of that into the community and work with patients on all levels of their health.
Perfect. Now, you're holding this cool, and again, when you talk about this, if you can hold it up.
Sure,
yep.
You're
holding this cool piece of equipment. Tell us about that.
Yes, I have this little assistant with me, and he does not, or she does not have a name, but is a type of ultrasound equipment that allows us to do a very rapid assessment of somebody's heart health when I'm called in, either from a rural hospital point of view or even here in the middle of the night. It does not replace a full, complete ultrasound that is performed by larger pieces of equipment, but it gives me enough clinical information right at my fingertips so that I can make some fast decisions and help to direct care more quickly. And yes, it does look like it's out of Star Trek. It works very well, and recently we were able to use this on a trauma patient here to help us determine some of the treatment plan for some of the surgeons involved. And so I've been very happy to bring it with me.
Is this something that other docs you expect will be using here, or are they?
I am the only one that has this one at this point.
Okay.
That's all good. I know what I forgot at the very beginning of this. I forgot. Can you, and again, talking right to me, just introduce yourself, so your name and your title and what you're doing here.
Sure. Okay.
Whenever you're ready.
Okay. Well, my name is Kathleen Harper. I'm an osteopathic physician. I trained here in UNE, which is in Biddeford, and.
Oh yeah, you can hold that back down. Actually, yes, thank you.
Okay.
We're gonna save that for the end.
No problem.
Okay, yeah, whenever you're ready.
Okay, so my name is Kathleen Harper. I'm an osteopathic physician, trained here at UNE, and working in the cardiology group with the office location in Auburn, and working with Central Maine Heart Association.